Welcome to the Biomechanical Blueprint, a field guide to sciatica relief. We'll cover everything from ergonomic defense and targeted movement to the realities of clinical surgery. Sciatica is a symptom, not a diagnosis, caused by irritation or compression of the sciatic nerve. Signals include sharp, burning pain, tingling, numbness, weakness, and back pain. It's important to differentiate between sciatica and piriformis syndrome. Sciatica usually involves lower back and leg pain, while piriformis syndrome causes deep buttock pain. Remember, stretching is not always the answer. It's critical to know when to seek immediate care. Call emergency services if you experience sciatica on both sides, severe weakness, numbness in the saddle region, or loss of bladder or bowel control. These are signs of a severe mechanical spinal compression. The environment often plays a role. Slouching or sitting for too long places excessive pressure on the lower spine, which can strain ligaments and compress the sciatic nerve roots. Implement the workstation blueprint for proper posture. Key points include monitor at eye level, arms parallel to the floor, lumbar support, and hips at a 90 to 100 degree angle. Take micro breaks every 30 minutes. The acute relief protocol involves 3 steps. Keep moving with gentle stretches and short walks. Use temperature therapy, ice, for the first 48 hours, then switch to heat. Finally, use short-term NSAIDs for pain and inflammation. The extension progression timeline has 3 phases. Start with prone relaxation, move to prone extension resting on forearms, and finish with standing extension, bending the trunk backward at the waist. The centralization gauge helps you track your progress. The right direction is when pain centralizes, moving from the leg toward the middle of the spine. Pain moving away is the wrong direction. For severe sciatica lasting 6 to 12 weeks, the intervention flowchart shows that early surgery offers faster initial relief. However, at 5 years, there's no significant difference in pain or disability compared to prolonged conservative care. For the long game, certain factors predict persistent pain. These include age over 40, high initial pain severity, and high psychological load, which is a major driver of chronic pain. The Sciatica Relief Master Plan involves 4 quadrants: acute management, biomechanical defense, active rehabilitation, and clinical escalation. Effective management requires deploying all 3 conservative approaches simultaneously.